Welcome everybody to the launch of one of the books of the year in public health, Good Health at Low Cost, 25 years on.
A key book that's like an instruction manual for the future of global health has just been published and was launched at the London School of Hygiene and Tropical Medicine. The meeting heard how 25 years ago the Rockefeller report, also called Good Health at Low Cost, reached a surprising conclusion.
Some poorer countries actually did much better in terms of health outcomes than some wealthier countries.
The message of this book is extremely positive. The book is showing that even in a very difficult economic and political situation, a lot of progress is possible. It is showing that there are countries who are achieving progress, and we would like to make this message being discussed at national level as well as in international forums. We would like to see more internationally known initiatives which address not just the health systems but other sectors together with the health systems.
Good Health at Low Cost, 25 years on, was produced by painstaking, detailed and comprehensive research done by an international team including the world's top thinkers and doers in the field of public health, many of whom were at the book launch in London. Exciting evidence from 5 countries was presented showing how to create excellent health systems to save lives and preserve good health for rich and poor everywhere.
A country like Bangladesh has achieved great health improvement, while with a level of out-of-pocket spending that is still the majority of health expenditure, even where the government plays a minor role in the health system. And where it's difficult to build up that role, there are still ways in which you can get considerable health improvement.
Professor Anne Mills was one of the editors. She was involved in all aspects of work, and she was also very much involved in the Thai chapter, working together with the team in Thailand.
I think what I wanted to get over was the value of doing this sort of comparative analysis, that by taking a number of countries and doing in-depth studies, you can really get a very rich picture of what were the causes of health improvement in those countries. I think the great sense of excitement about the book and its findings, and the sense of optimism that it is feasible to improve health in relatively low-income countries.
For me, the most important thing that came out of this meeting today is that it got us into the places that really matter. We spend so much of our time talking about global inequities in rarefied intellectual domains which have nothing to do with people and nothing to do with countries. And these great global calls to action, while they're worthy and well-meaning, really don't have any material effect for the people that they are supposed to be designed for. This meeting, this book, is all about the people in countries, and it gives us clues about how to achieve social and economic justice for them.
Ethiopia's achievements in creating better health for all served as just one of the examples from the book being discussed at the launch meeting in London.
Ethiopia focused on primary health care and disease prevention, and also on capacity building to make sure that services are sustainably delivered. And it has also created a political atmosphere where people assume responsibility for their own health. And this has been also supported by technical details, including training people to plan and prioritize their own key concerns in the health sector.
Ethiopia is a very interesting case. Ethiopia has a very strong government. The health sector and the health minister of Ethiopia is known for being one of the very outspoken participants in the global agenda. He initiated a lot of regional initiatives. He has very much put Ethiopia on the forefront of international development.
Governments in other countries must really put their people at the center of development. And they have to be concerned about how to really include all people and benefit from development efforts. And health is central, and it is duty and responsibility of governments to make sure that people are accessing health services and also getting the right education to take care of themselves. I think that's the most important one in the Ethiopia context.
What we know is that there's low-cost, low-tech innovations that can be adopted perhaps globally that can make huge improvements in global health at low cost.
Dr. Tracy Koramos was leading the Bangladesh team, and she was the author of the Bangladesh chapter. They conducted extensive amount of work, overviewing the literature and conducting more interviews to actually disentangle what is it about the Bangladesh miracle. What are the reasons for this achievement? And a lot of the factors are within the health systems, but many of these factors are outside the health system, such as the decreased fertility and improved education of girls.
I would say that the overarching issue that made Bangladesh a successful example of good health at low cost was the political commitment to health that transcended individual political party, that this was a whole of society, whole of government approach and commitment to health.
These are countries that had institutional continuity. In Kyrgyzstan, in Thailand, in Ethiopia, the institutions persisted despite revolutions, despite changes of government. If you have an institutional system and you constantly change it, and this has lessons not just for developing countries, but it has huge implications for the disaster that is unfolding in this country at present. If you constantly change things, then you cannot hope to have a successful healthcare system.
Professor Martin McKee has long-term experience in comparing and analyzing health systems. Today he talked about the need to put the health system's diagnosis and then move to finding solutions. And he talked about the challenges of countries learning from each other.
And we've got the stories of the individual, the stories of the nomadic people in the Ogaden in Ethiopia who are struggling to get healthcare out to people who are constantly moving from place to place, the stories of the people in the floodplains of Bangladesh living with the ever-present threat of the rivers coming down and washing away everything they have, the stories of the people living in the mountains of Kyrgyzstan trying to get healthcare when the nearest post is kilometres and kilometres away. So a focus on people, a focus on understanding the countries.
I'm very pessimistic about how we can advance the claims for comprehensive primary health care for health system strengthening. Most of the global institutions that we have today have no interest in seriously strengthening health systems. They have no interest in truly comprehensive primary care, by which I mean multi-sectoral action for health and social justice. They are much more interested in vertical health programs, in short-term political goals. So I think there's a constant fight, almost a war of ideas that we have to engage in if we're really going to make the evidence for health count where it matters.
The most important step that needs to be taken is a step which is at national level, national and subnational level. We are aware that a lot of civil society organizations are fully aware of the issues, and work at national level is extremely promising from what we can see in the countries. In fact, a lot of the countries in this book have undergone either independence or major political changes, which in a way made way for radical health reform.
I think the key ingredient of success for good health at low cost is participation by the community. It's only when you have demand from the community, holding political leaders, holding policy makers to account, forcing them to devote more resources to health, that you will really start to get social change. So it's about mobilization, it's about participation, it's about advocacy, it's about political change. That's what we need to get health onto the agenda.